Hey class, welcome back. Um, so hopefully you already watched the previous video that I posted on the knee anatomy. If you haven't already, go back and watch that first. I figured that was a good one to watch because they already did a great job of explaining all the structures of the knee, and the animated version is great to actually see the knee motion and all the different aspects of the knee. So I just wanted to take a few minutes to go through and let you know the important parts for this class and what you might be tested on and what would be helpful for your rehabilitation projects. Um, so first thing, and the guy in the video did a great job of explaining, but the knee joint is just very complex and can go through a lot of trauma due to the just the design of the joint itself. Because there's not a lot of structural stability, bony stability, it can be injured very easily, especially during athletic competition, in which people land on their knees weird or get hit in the knee or something like that. Um, so it's a hinge joint. So basically the femur and the tibia hinge on each other, but there's also a rotational component that he didn't talk about, but the tibia rotates slightly as it flexes and extends. And that's an accessory motion that helps to get into full extension and full flexion. Um, and he did a great job mentioning the ligaments that create the stability of the joint. So the knee really relies on those ligaments for stability because of that lack of bony stability. And then a nice job talking about the joint capsule. So there's ligaments all around the joint that create a capsule. And that's called a synovial joint, and there's synovial fluid in it. And I'll mention that synovial fluid when we talk about rehab exercises. But when we're trying to create range of motion in a synovial joint, having that synovial fluid be pumped back and forth and moved around really helps to increase range of motion. Kind of like a hydraulic joint or something. Hydraulics always have a hydraulic fluid in them, and if they don't, then they don't move very well. So it's the same thing for the knee. That synovial fluid provides better range of motion for the joint. Okay, and then he talked a little bit about the muscles. We'll talk a little more specifically about them. So yeah, let's get into it. So in the knee joint, if I'm going to test you on anatomy, the things that I want you to know are the femur, which we talked about in the thigh and hip. We talked about the proximal end of the femur, but now we have the femoral shaft, and then this is the distal end of the femur. Okay. Um, on the outsides of the distal end of the femur, we have the epicondyles. Okay. In that video, he talked about the condyles, which I'll talk about in a second, but the epicondyles on the outside is where different muscles and ligaments are going to attach to. So this is the bony spots, these epicondyles, where muscles and ligaments are going to attach. Then the epicondyles on the inside are the white articular cartilage that helps the joint to move more smoothly so that it's not rubbing bone on bone. Okay, and that articular cartilage is on the condyles, but it's also on the tibial plateau and the back of the patella. Okay, so epicondyles are attachment sites. The condyles are for better, smoother range of motion. Okay, this is the front of the knee right here. So in the front of the femur, we have the femoral groove right there. And the femoral groove, or the trochlea, is where the patella is going to glide through. Okay, in good range of motion, it glides through there seamlessly. Something that happens with a lot of muscular imbalance is that muscles pull that patella out and it grinds on kind of on the condyle and the epicondyle of either side of the femur. Okay, but in good range of motion, it glides right through the middle. Okay, Then this is the patella, or the kneecap as we call it. It has an inferior pole, or an apex right here, and that's where the patellar tendon is going to attach, and the patellar tendon is going to come down and attach into the tibial tuberosity. Okay, so tibial tuberosity is something you should know. Attachment site for that patellar tendon, which goes up into the inferior pole of the patella, and then the quadriceps tendon, comes off the base of the patella, or the superior aspect of it, and goes up and attaches into the quad muscles on the femur. Okay, and that whole segment is very important, and I'm going to show it to you from the lateral view in a moment. But it's very important for knee extension, for jumping, running, squatting type movements. Okay. Out here on the outside, we have the fibula. Okay. We always know if it's a right or a left knee, because the tibia should be on the medial side, and the fibula is always on the outside, on the lateral side. Okay, so we know this is a right knee because we're looking at it from the front, and the fibula is on the outside. Okay, so that's how we know it's a right knee. Here we're looking from the back side, fibula is on the outside, so we know it's a right knee. Okay. Another thing to point out that's not on this diagram, right here is where the pes anserine insertion site is. Pes anserine. We'll come back to that in a minute. Okay. Over on this side, we should know that the condyles, the medial and the lateral condyle, patella again. And then on the tibial plateau, okay, this is called the tibial plateau, the top of the tibia right here. And that also has a lateral condyle and a medial condyle. And that's for articulation with the femoral condyles. Okay, so tibial plateau, we should know, fibula, tibia. Okay, so those are the bony aspects that I want you guys to know. That previous video did a great job talking about the menisci. Just remember, you have a lateral meniscus and a medial meniscus, and they help. The two things he talked about that they help with are providing stability, because they're kind of like that cupped shape. They help provide stability, and they are also shock absorbers. They help disperse the shock of weight bearing, running, jumping, all that stuff, so that all the weight isn't put into one spot on the tibia. It's spread among the whole tibial plateau. Okay, so shock absorption and stability. Okay, you should know those two things about the meniscus for the quiz. Okay, and then this is just some extra knowledge for you. If this is the shape of the meniscus, sometimes we talk about the red zone, white zone, and the red-white zone. Red zone has a lot of blood flow, so if you get a tear in that part of the meniscus, it can heal on its own because it has blood flow to it. In the white zone, there is no blood flow to it, and so it can't really heal on its own. So a lot of times, if it's torn, we either leave it, or a doctor will go in and just shave off the torn part. It's called a meniscectomy. They just shave off the torn part, and then you're good to go, but you have less meniscus than you used to. Okay, the red-white zone is kind of an in-between where there is some blood flow, but it's not great. All right. Looking at some of the ligaments. Okay, I know he already talked about them, so I'll cruise through them, but this is looking from the front side. On the outside, the lateral side, we have the LCL, the lateral collateral ligament. It goes from the fibular head to that lateral epicondyle. On the inside, the medial side, we have the MCL. It goes from the medial aspect of the tibia to the medial epicondyle of the femur. Okay, that's why those epicondyles are important. There's the MCL. And those help prevent valgus and varus movements. And the animated video showed it a little bit, but if we were to push on the inside right here and open up this lateral aspect of the joint, that would stress the LCL. And that would be a valgus, a varus, V-A-R-U-S, stress. Okay, because it's opening the joint away from the midline. Varus is opening it away from the midline. Now, if we were to push on the lateral aspect and open this medial joint, that would stress the MCL, and that would be a valgus, V-A-L-G-U-S, valgus stress. Okay, so we have a varus stress on the LCL and a valgus stress on the MCL. Okay, and obviously if that stress is too great, it can tear those ligaments. Okay, and then the video did a great job talking about the ACL and the PCL, preventing anterior and posterior translation of the tibia. And obviously if those stresses are too great, it can also tear. Okay. This is what I wanted to show you about the this whole continuum from quadricep muscle to the quadricep tendon into the patella, into the patellar tendon, and then attachment into the tibial tuberosity. Okay, this is important because the patella creates a bigger fulcrum, and he talked about that in that animated video, but I wanted to explain that a little more. If you think about, and if you haven't taken physics, this might not make as much sense, but to create a bigger torque or a bigger force, you want to have a bigger fulcrum. And so if the quad tendon came straight through here, straight into the patellar tendon and down, there would not be very much distance from the center of the joint to that tendon. Okay, and that means that when the quadriceps contracted and extended the knee, you wouldn't be able to create a very great force. But because the patella is here and it pushes that tendon out all the way out to here, now it's a much greater distance from the center of the joint to the fulcrum, or where the tendon passes through. And what that allows is for a much greater torque to be created, which is why we're able to jump high, kick a ball very hard. It's helpful with running, all kinds of things like that. Okay, so basically we've increased from the center of the joint to where the farthest point out of that tendon is, and that's increasing the fulcrum. Okay, so if you've taken physics, you know torque equals force times distance, and this is the distance. We've basically doubled it by moving it out farther. Okay. A couple more things. Here's the muscles again, and we pretty much already talked about all the knee muscles. We talked about the quadricep muscles. We talked about the hamstring muscles. I do want you to know those specifically, so if you need to go back to the thigh video, then you can. But one thing I wanted to show you, see this pes anserine right here? That was that spot I was talking about on the bony anatomy. That's an attachment site for the sartorius coming across the hip and down. Okay, the gracilis, that's the groin muscle that comes down the inner thigh, and the semitendinosus of the hamstring muscle. Okay, so all three of those attach into that spot right there. So it can be very easily inflamed. And the mechanism that we use, here's all the muscles: sartorius, gracilis, semitendinosus. And we call it, we use the acronym SARGENT, like a sergeant in the Army or the military. And the abbreviation for that is SGT, sartorius, gracilis, tendinosus. So that's one way to remember which three muscles attach into the pes anserine, and you will need to know that for your quiz. Okay. I think that's all I want to get to in this one. In the next video, we'll talk about the rehab exercises.